Welcome Facebook's friends, back again here at San Antonio Cosmetic Surgery Center. Today we're going to be doing our wonderful Vobella product. We have been asked by many patients about filler under the eyes. People are real concerned with losing fat, hollowing of the eyes, something called the tear trough area. So today that's what we're going to treat our lovely patient with, Elizabeth, also a staff member here at San Antonio Cosmetic Surgery Center. And Dr. Blumholtz, join in.
Oh, wait.
A little late, but he's here.
It wouldn't be Wednesday. Hi, it must be
It wouldn't be
Wednesday.
Wednesday without him.
Welcome
exactly.
to San Antonio Cosmetic Surgery.
Hi, Dr. B.
So we're going to treat your lids
Yes,
area.
sir. So
Awesome.
I marked her a little bit so people could see how much hollowing she has in this area, right in here, as you can tell.
I'm going to change the light for just one
there
second.
you go. Can you see that better?
Yes, and we'll get
Okay.
a side profile. So you
And we
can
took
see.
pictures of her already before I brought her into the office. So she's lost a little bit of the fat under the lower lids, down in the corner. I'm going to try to just soften her up and give her a little bit more of that restful look right there. Definitely smile for me. When you do Botox, it softens her out here, but it never treats the lower lid area. So,
Smile again, Elizabeth. You can see how it goes in right underneath. It creates a hollow. What is the best candidate? How do you know if you're a candidate for fillers under the eye?
usually patients that come in that actually ask, what can we do to help with this hollowing? They want me to inject Botox thinking that that's going to help this area, and it's not, because I don't want to relax the muscle in here and I don't want to go anywhere. I want to fill this area. For a long time we didn't have a product that wasn't going to hold on to a lot of water and make my patient puffier than what she already was, until we found Vobella, which does not hold on to water. So when I inject it, it stays in and gives her a nice smooth look. Okay? Dr. B, you want to chime in?
Are there candidates that are not a candidate?
Yes.
Or if you, I should say, are there patients that are not a candidate for filler under the eye? Or
Yes.
when would you not want to do it?
Dr. B then will tell me, and he'll see a patient that says, this patient definitely, even if there's too much fat under the lower lid and there's a surgery that must be done, too much of the sagging skin, where then our expert here will come in and do his lower blepharoplasty.
Right, so what we're talking about is that there are times where someone will have progressed beyond a mild to moderate change here, and by adding more filler, it'll just add to the bagginess under the eyes, and that makes for some unhappy patients. So we try not to do that as much as possible. But I think Elizabeth is going to be a fabulous, fabulous candidate, and I will leave you guys to it. So from us here at San Antonio Cosmetic Surgery, have a happy and safe, prosperous New Year, and a happy Merry Christmas, and a happy Hanukkah, happy Kwanzaa, whatever might be coming your way. And we're excited to celebrate with you all in the new year. And I'll leave you guys at it. Thank you, expert. Thank you very much. I'll see you soon. Yay, bye.
All right, so I'm going to begin with her right eye, and I'm going to start in what we call the tear trough area, right down the middle. Like always, I use my fancy spray. Close your eyes, Elizabeth, for me.
And this area is also referred to as lower blephs, tear trough, under the eye,
Open your eye.
bags. And filler is used for people who have dark circles or saggy skin and hollowing in the area, like Cynthia said. Elizabeth, our lovely model for today, has already been numbed and diagrammed, as you can see on her other eye.
So this product goes in really nice. It just goes in and then stays right where I want it to.
Are there other types of fillers out there that have been used for under the eyes?
Yes, there are. There are other fillers that you can use. The only problem with it is that they hold on to a lot of water. What does that mean to the patient? That means if I have a product that's holding on to water, it's going to give her more of a puffy look instead of more of a contour. You see already the softness just with a little bit of product I've put right near her tear trough right here. See the difference in there? There's a hollow there. Now we're softening up and the transition is getting better and better.
And it's immediate.
Instant gratification, what I call.
And that was just with one little poke.
Okay. And as you can see, Elizabeth's doing really well. She's not moving. She's not crying. She's just very steady, a good, good patient.
I have a question from the audience. They want to know how far up the eye or close to the eyeball do you get?
I'm nowhere close to the eyeball. I'm right in the orbital rim, right in here. As you can see, there's her eyeball there. This is right the orbital rim in here. You can feel the bone, and that's why I lay it right above that. Very little bleeding.
How do you feel, Elizabeth?
I feel fine. I don't feel anything at all.
Great.
She's a very, very good patient, I must admit.
Thank you.
Is this her first time being treated in the eye trough area?
It's the first time I've ever treated her tear trough area. One of these areas that I noticed on her, sometimes people that have sinuses, that have problems with allergies, they're the best candidates. And patients do extremely well. I mean, the downtime is practically nothing, just no working out. Do you see that? How
Wow,
that just
you
sits
can
in?
see an immediate difference. It's better than that stuff that we've seen on Facebook, that glue that goes under the eye.
And it stays in for 1 year. That is the beauty of this product. It stays in for 1 year.
And we are running a end of year promotion on this filler. This
On
is
all our
Volbella.
fillers. Volbella is part of the Allergan family, like Juvederm, Voluma, Botox. It's part of that family. We're running the special until the end of the year.
Elizabeth, that looks amazing. You're going to be so happy. Merry Christmas, Elizabeth.
Yay, thank you.
Okay, relax. And so I want to get at the edge also. Give her a little bit of softness right there. To make her
Again.
have a nice transition of her lid. I'm sorry.
Question from the audience.
Yes.
They were asking, is this procedure for deep bags under the eyes?
Again, that's what Dr. Baumholt and I spoke. If you have full bags where there is a heavy fullness of a fat pad in here, it really depends on the candidate. If there's too much fullness here, well, I will only create more fullness with the product. It's a lower blepharoplasty, which is necessary, which is an incision on the lower lid. The fat pad is removed, and then there's skin tightening. When there's loss of fat in the tear trough area right in here and in here, as you can see on this side, treated, untreated side, I can add the filler that gives me the nice transition there. So every patient should be consulted with myself. If I feel that this is something that I cannot do with my magic product, then I have them see Dr. Baumholtz or Dr. Ortegon for actual surgery. But see, this is a nice soft transition for her. It relaxes kind of that strong muscle look with the fullness. It just gives me an even transition, almost pops up the cheek a little bit more. I use this in combination with all my products. So people say to me, oh, I want to do this, but then I have to come back for Botox or Volbella or for Juvederm. No, we could do it all together. I could treat Botox on her forehead, around her eyes, Juvederm, her lips, Kybella for under the neck. It is one of these products that I love to use in combination with everything else. Patients do really well. As you can see, I mean, she has
It creates definitely a rested,
very rested
more
look.
youthful look to the face.
It's just a soft transition. And again, people say to me, what's the downtime? There really isn't a downtime. She's sitting right here. We will make her go back to her desk in a few minutes and start working again. We cut them no slack. That is for sure.
You could definitely go back to work.
Oh,
Is
yeah.
there any prerequisites or recommendations for after this procedure?
No working out for 24 to 48 hours for sure. Before the treatment, I do tell patients don't have any aspirin or ibuprofen because this is a sensitive area under the eyes. It is very tender, it's very thin, so I would prefer. And then I will always use arnica cream with vitamin K that we sell here in our office, actually. That'll help with any bruising or swelling in this area. So this is all I do. I just apply it afterwards, and that's about it.
And you don't recommend any exercise, like you said, or
No.
any up and down motion with the
No,
face,
no.
massages.
No
or-
massaging. Once I place the product is in nicely, as you can see. Once you place a product, it gives me a soft look. I'm good to go.
And it's important that they stay upright at least for the rest of the
the
day.
next 4 hours at
4 to
least.
6 hours.
Mhm.
Excellent.
Retouch it
How
a
are you
little.
feeling, Elizabeth?
I feel fine. I don't feel anything. I don't feel the insertion of the needle.
Fantastic.
She's a very,
Well,
very
Cynthia's got the touch of an angel. She's been doing this for many, many years.
All right, there we go. See how pretty that is? Just a soft,
Wow.
soft change for her.
Will you be able to put makeup on right after?
20 minutes after we're done, definitely she can go and put her makeup on, start seeing any patients here in our office, talking to people, not a problem at all.
Just no heavy massaging.
No
under
heavy
the eye.
massaging. I don't need her to do any massaging at all. This is
Wow,
everything.
you can see the
Before and
difference.
after. definitely. You can actually see how nice it's changed. Again, I like to see all the patients here in the office for consultation before you say, yes, yes, I want to do it. I do young girls as young as in their 20s that come in and then just they have their look from their mom, their dad, where they just carry a little bit more fullness in the lower lids with a little fat pad. This will give them a nice transition softness from that little fat pad to the loss of fat in the orbital rim area. It'll just soften them out.
And you can see the difference. I just showed the side that was done and the side that we're still yet to do. What a huge difference.
And we could just wipe. I did that more for dramatic looks. I colored that lower lid so you can see trimming where we're going, but you can see the difference. Definitely.
That's amazing. Do some people bruise?
Some people will bruise, but nothing that makeup wouldn't be able to cover. A small little dot from the incision of the insertion of my needle, which is a very small needle, but other than that, they do extremely well. As you can see, one little red spot there, one little red spot there. Nothing she couldn't cover with makeup in about 10-15 minutes. Okay.
I have a question from the audience.
Yes.
They want to know again how long it lasts and if there's swelling after.
Last 1 year, very, very little swelling. As you can see, that is as much swelling as she will get. What you see is what you get after the product. That is one of the beautiful things about Vobella. Vobella, once you place it, it sits, does not hold on to water, does not have lots of swelling. This is exactly what you'll get as a result. I use this also around the mouth for some patients that have little fine lines around the lips, what we call the smoker's lines, people that don't want to have a full lip but just want to get rid of those creases. It goes in, it sits, it holds on to it. Again, whatever you see at the end is what you get. So as Jen reminded you, all of our fillers and our products are on sale until the end of the year. Vobella, Voluma, Juvederm, all $200 off till December 31st. So if you guys can't get in to see me, at least you can buy it and we can program your appointment for the new year, for Valentine's Day, getting ready for spring. Botox, $9 a unit also until the 31st of December.
So all our injectables are
Yes,
actually,
ma'am.
we're having an end of the year.
End of the year sale, definitely.
An end of the year promotion. And of course, we're doing our complimentary consultations for injectables with our lovely nurse injector, Cynthia. So please call and schedule your appointment at 210-614.
614-4320. We're in sync, Jen and I are.
Yes.
The other thing is with our patients also that are looking for good skincare for their lower lids, TNS Eye Cream Repair is a beautiful product too. You incorporate this with actual treatment. It'll help you with the puffiness, the swelling, anything that you already have and you come in. This is only enhancing all of the treatments that I do. So remember that. Again, 214-614-4320 for our phone number. Like us on Facebook, any questions you may have. I'm going to do the other side, see if we have any more questions, Jen, go over
Of course.
what we're going to actually be doing next week, which is going to be something really interesting next week.
Yes, next week on our live stream, we'll be doing sclerotherapy and vein treatment.
Yep.
We're going to find a lovely, willing candidate for Monica, who is our vein specialist, to treat those unwanted, unsightly veins that we try to avoid if possible. This is the best time of year to do it because you can cover up. It's cold, you can hide them. It's legging season, boot season, so you can cover up those vein areas after being treated. We're going back to the other side of Elizabeth for her eye filler. Again, this is with the Allergan family filler, Vobella. There are many other types of fillers out there for different areas of the face. We carry them all, but this is one of the newest and we find best fillers to treat this area, known as the lower blebs, tear troughs, orbital rim of the eye.
Again, like I said before, I love this product. Why? Because once I place it, it stays in. It does not hold on to any water. Patients love the fact that they get instant gratification with the results. I like that too. It's pretty. It's nice to have a product that gives you instant results. You don't have to wait. You just set it in and it places. Patient tolerates it very well. Very minimal, if any, swelling.
And you can look forward to next week. I just got a question asked if we can post Elizabeth's pictures
Definitely.
next week on Wednesday at our next live stream or sooner. So stay tuned for those pictures for those who want to see Elizabeth a week from now. We're happy to show those. And lucky for us, we have access to Elizabeth Monday through Friday. She works here. We drink the Kool-Aid here at San Antonio Cosmetic Surgery.
Definitely. And if anybody wants to call and ask her any questions, also feel free. Just ask for Elizabeth. Ask her, how did that feel? How did you feel afterwards? What did it hurt? Did it was uncomfortable? I mean, you could see she's barely even moving as I'm treating her.
I have a question from the audience.
Yes.
They want to know, how many syringes does it take to fill the area?
Tear trough area usually takes about 2 syringes, 1 per side. As you can see with the other one, I went all the way around and to the corner. Same thing for this eye. I'm going to use, sometimes I will have to use 3. So 1.5 and 1.5 depending on the depth or the loss of fat around that area.
But Cynthia's awesome. She discusses that with you
Definitely.
before we get the procedure started to make sure that we tell them what to expect. Everyone knows what to expect before it's done.
Yeah, and I want you to feel comfortable with your decision. I'm not going to push on anything that you're not comfortable with. If you want to take baby steps and do one and see, usually I always tell this story. Patients come in and then I give them my suggestion. They say, okay, well, this is my budget, and we do one, and then they walk out to the car, they look at themselves in the rear view mirror and they say, oh, she was right. I really needed to. And they'll come right back. And I don't have a problem with that. You definitely with filler can always add on to the product as you go. It's not like Botox that you have a time frame. So it's nice for me, definitely.
That looks amazing, Elizabeth. Just in time for the holidays.
Mm-hmm. She's really tolerating it well.
Again, we are going to be having a live stream next week for sclerotherapy, the vein procedure treatment. It is done here in our office. So if you want to learn more about that, you can join us next Wednesday. If you have any questions or want to speak with Elizabeth about her experience, our phone number here is 210-614-4320.
Feel free to call, ask her any questions. She will be able to talk after this.
How are you feeling, Elizabeth?
I feel fine. I don't feel anything at all.
Yeah, she hasn't even flinched once, if you've noticed. She keeps a steady eye for me, movement, which makes it really easy for me to inject for her.
And that
There you
needle
go.
is so tiny. It's
It
an
is.
itty bitty needle. It's hard to feel. I mean, when it goes in.
Even Genevieve, our practice administrator that doesn't like syringes, does very well
I
with these.
don't like needles at all. It's amazing I'm able to even watch some of this stuff, but definitely. Now, Elizabeth also has had Botox in the past because we do believe it's a combination of
Yes.
services and products that help maintain the integrity of our skin and the youthfulness and the rested look. A lot of these are combinations where you're using some sort of skincare treatment. Cynthia had mentioned our TNS eye cream, which is also in the Allergan family, the Skin Medica.
Yes.
And this is the eye cream that we like to use. And we also have other eye creams that don't have the TNS in it. We just recommend that there is some sort of skincare regimen used daily on your skin, whether it's your face or your body. Highly recommended. And sunscreen, a definite staple.
Definitely.
Yes.
All right, she did great. She's got a really nice result. She'll be able to go out, put her makeup on, go to Christmas parties, no problem. Just no working out for 24 to 48 hours.
You
Okay?
didn't bruise at all. Great. Awesome.
All right. So again, remember our specials till the end of the year off our Botox and our fillers. Free consultations to come in and see. Just talk to me. We'll go over a plan, what we can work. If it's not everything at once, we'll plan it out to what works. Everything that we offer. We've got our both plastic surgeons, Dr. Adelio Ortegon and Baumholtz. We have Amy, our esthetician. We've got Monica that'll do all your veins and laser. Any of the girls that can answer any of the questions regarding our treatments. Jen, our practice administrator, of any questions that we can't answer, definitely we will refer to her. And again, you have me, your nurse injector, that would love to talk to you all and treat you. All right? Any other questions, please feel free to come on Facebook and ask us, call us. We're all here to answer your questions. Anything I forgot, Genevieve Mendoza?
Nope, I think we're good. Just for everyone to have a wonderful, safe, happy holiday, Christmas,
Definitely.
Kwanzaa.
Thank you for being so faithful to us and coming every Wednesday to watch it. We really enjoy hearing from you and letting us know what really piques your interest. That's what we're here for, to educate everyone regarding what our practice, San Antonio Cosmetic Surgery Center, can do for you.
Thank you. Bye.
Thank you. Bye.